So my name is Jonathan Morris, Dr. Jonathan Morris. I'm from the Mayo Clinic in Rochester, Minnesota, and it's a real honor to be here today to give my presentation. If you've never heard of Mayo Clinic was started in 1883 because a tornado came through the area of the United States where we live. And during that time, William Worrell Mayo, one of the founding Mayo father, and his two sons were traveling through that area, and through a collaboration between them and the Franciscan nuns at that time, they said, if you stay here, we'll build you a hospital. And from that time until today, that co-creation between multiple disciplines and multiple types of people have formed what we have at the Mayo Clinic. Over the years, we have built all different ways to see patients and take care of patients. We have built infrastructure. We've built things like the medical record, that you would retain a medical record. We've built ways and efficiencies of seeing patients throughout multiple different floors because what we pride ourselves in is efficiently taking care of complex diseases. And we've invested in technology over the years to bring in so that we can see patients in different places. We're ingrained in telehealth and teleradiology, tele-ICU, telestroke. We are ingrained all over the Mayo Clinic enterprise with this sort of telepresence, and yet we still have a problem. Despite undergoing what now is a $5 billion expansion in southeast Minnesota, with another $1 billion expansion inside of Florida and Arizona, that we are still co-located with our patients. So the fundamental underpinnings of Mayo Clinic are the needs of the patient come first. Every bit of innovation, anything that we put into our hospitals, all has to fundamentally serve this need. And if it doesn't serve that need, then we don't put it in. So AI, Internet of Things, smart, all these things have to serve this need. So what I'm going to talk about today is some of the challenges we face. And one of those challenges is, despite what looks like to be about a $7 to $8 billion expansion, we are still limited in the people that we can see and limited in the patients we can interact with because we're basically one doctor, one place at one time. We're limited in this ability to be with our patients who trust our medical data. And despite that, even where I work in a small town of 100,000 people, we service 1.5 million people from 150 countries as a destination medical center. And in my small town, we perform 1.5 million CT scans per year. And we read those CT scans, and if you get them at Mayo Clinic, they will be on your phone in under 3 hours. So in real time, you come in with a problem, and then you receive your results like this, alone, on your iPad, on your iPhone, and we might tell you something significant as you have breast cancer, kidney cancer. You might have an inflammatory condition. And they have all sorts of questions that arise that we just don't have enough experts to answer all the questions. And quite frankly, nobody does. So we started thinking, how can Mayo Clinic expand beyond the walls of Mayo Clinic and expand beyond the physical constraints? Because we will never have enough experts. And some of this is only possible now. It's not that we haven't had this thought for over 50 years. Some of this is only possible now because of this convergence of technologies, this ability to have multiple technologies come together to constantly drive innovations inside of Mayo Clinic. So if you look at how we're incorporating AI now, none of that could have happened. What the people have been talking about in AI over the last 40 years here with Nobel laureates and Turing Award winners, none of that can come to where I work, translational in front of a patient, until the increase in chip speeds, and still the increase in Wi-Fi, until the power grid can handle all of this, so that we can at one point start to digitally twin our experts. We've got about 4,500 physician experts at Mayo Clinic. We receive thousands of patients, hundreds of thousands of patients asking to come to Mayo Clinic that we have no way to provide care for despite massive expansions. Because there's always been an expertise crisis. There's always been a global expertise crisis where there's not enough experts. Gathering experts together at places like this is wonderful because you can collaborate with multiple people and have multiple ideas, but I receive at least just 10 friend phone calls per day. Can someone at Mayo Clinic look at my wife's films? Can somebody help me with my uncle? Can somebody answer this clinical question for us? Can we come to Mayo Clinic? And that's just not germane to us, that's germane to the global population of people that have to serve very large populations in multiple countries. And we have a lot of experts, internal experts, even colleagues Like somebody yesterday was giving a talk at the opening ceremony. He said, AI has become an assistant to me, a helper to me, and I want a colleague. And I said, yeah, me too, because I call this guy like at least once a day to ask his expert opinion. So we have internal experts even for us that we can ask questions of, and people want access to all of these experts in order to be able to help them in their medical needs. We had a patient fly, I talked to on Friday, they flew to Mayo Clinic Sunday, they're getting surgery by this man today, right now, because they wanted to come see an expert. And our experts are limited. Luckily, he was available. So we're starting to create infrastructure. How do you begin to scale across an enterprise, 4,000 something people? How can we make breast cancer experts, infectious disease experts available for people? How can we make digitally twinned AI medical experts that are trustworthy, empathetic, that are guided by the principles of the needs of the patient
Mayo
come
Clinic
first?
has a long, rich history in
So you can see
providing the
my AI
best
expert
possible
here.
team-based care, focused on the needs of the patient. Throughout our history, we've been expanding our physical and digital footprints to meet the ever-growing demand for Mayo Clinic expertise. Luckily, we are in a special time in history where pioneering technologies from the entertainment industry have converged with computing speed, cloud-based delivery, mobile computing, and AI algorithms to create scalable, cost-effective, photorealistic, digitally twin Mayo Clinic staff members.
Let's see how that would work.
Hello, Alice. I'm Dr. Morris, a radiologist and part of the team involved in your care. How can I help you?
I see my x-rays came back, but I don't understand the report. Can you tell me what you're seeing in my hands?
Yes, I've just reviewed your new x-rays and compared them to the previous ones you had done. There appears to be slight progression of your disease.
So if we're going to do that across 4,500 people, we're going to need real enterprise solutions. Just on the front end of being able to capture that many people, voice clone that many people, manage that many people, secure them. There were some discussions today and yesterday about deepfakes and securing. How do people know that they're talking to a Mayo Clinic expert? All of this has to happen before I even utter a word. And ultimately, what we want that person to be uttering a word in is under 100 milliseconds, because that's human speech, and humans don't like waiting for answers. You know, and the challenge is, there's challenges on the front end, and I'm really focused on creating trustworthy, empathetic people, because people want to talk to other people. People want to talk to physicians from Mayo Clinic. But there's a challenge on the back end too, because there's a real AI dilemma in healthcare. So Mayo has fully embraced AI. We have 364 AI algorithms running every day across everything from ambient listening in the room and auto typing up your medical report, to evaluating your labs, working on your genetic history. We've really embraced AI. In fact, in my specialty alone in radiology, 75% of all FDA-approved AI algorithms are in radiology alone. So we've really embraced it. But the challenge with this is, you know, AI is not really grounded in a solution where there's no guessing, no drifting, no improvisation, no degradation over time. And we're the #1 hospital in the world, as ranked over the last 10 years, which means our answers are trusted. And if we are going to be a brand that's the most trusted healthcare brand globally, then the AI expert making a mistake has dire consequences. And the C-suite of my institution, the legal people at our institution, are very worried about that. Yes, you can do it technically, but can you deploy it, and how are we going to ensure that the AI expert is not giving wrong information, because that is the #1 thing tied to our brand globally. So we're developing with companies, in this case we partner with a company, New Realities, in order to create this grounded truth and be able to put all the knowledge of Mayo Clinic in a vault of our own, have our own librarian like a Franklin be able to look in that vault and be able to distribute it across multiple different specialties. Because medical information is very fragmented. It's extremely siloed and fragmented. It exists in books, videos, knowledge, 5-year training programs, 8-year training programs, and then a lot of it exists inside of somebody's mind. For the last 10 years, they've practiced medicine, and they've combined all the rote material that lives in these fragmented silos with their own experience and created this clinical expertise. They've connected all the dots of the fragmented silo information, and that's eventually how you get an expert. But that's very difficult if we're going to be able to create AI medical experts. One of the things we're going to do is get all of the knowledge out of these experts' heads that has already connected all the dots, because simply just scanning all the material of the world and putting it into a large language model and feeding it back to you is not what people come to Mayo Clinic for. They come for it to say, okay, now with all that information and your expertise, how are you going to give me an answer to me? How are you going to create a digital twin of me? How are you going to look at my labs, my clinical history, my genetic history? We have 30 million anonymized notes that we're building an entire platform to that we can say, what should you get in your history with your genetic makeup? So we're having to combine all that, because if we're ever going to take what's real on your right and make a digital version of that on your left, well, it has to be trustworthy and it has to be based off Mayo Clinic expertise. Now, if we do that, there's a lot of solutions. We work in patient education where there's 24/7. We can provide multiple languages. It can be cross-platform. We're doing a lot in workforce development, and certainly we're doing a lot in the practice in order to do this. Because if you get a new diagnosis of breast cancer, you want to talk to Santhia Pruthi or Judy Bowie or some Mayo Clinic expert who's a leading edge expert of breast cancer. And AI is not great on the leading edge. They're not great at summarizing the leading edge of what's happening. And we have a lot of materials, videos, pamphlets, legally approved, 4th grade level, 5th grade level, 8th grade level. We don't put things at PhD level when we build patient education material. And we have to take all that together, combine it with a person, and then throw it through a pipeline, and then red team it, and put a human in the loop, all in order to just get one expert. So we have to build solutions in order to do that across every subspecialty at Mayo Clinic, because it's vitally important for us to be able to take Santhia Pruthi and deliver her to the world. Because there are people that Mayo will never touch, there are people that Mayo will never meet. And the same information that our patients need for breast cancer is the same information that anybody in the US needs for breast cancer, or globally. We work with several centers globally to be able to take Mayo Clinic's expertise around. In the United States, we just crossed the 2 million mark for new cancer diagnosis. So we have a population of 300 million people, and we just crossed the mark of new diagnosis of 2 million. And there's 18.6 million people living with cancer. So how can you provide an expert to 18 million people who have questions at 8 p.m., 10 p.m., 6 in the morning, questions about their chemotherapy, questions about their radiation, questions about their genetic makeup of their tumor? How do you provide a therapist for them? An oncologic therapist has been proven to have progression-free survival outcomes, and yet if you look at the curve of how many we're making, it's going dramatically down. There's no way to solve that problem with human capital. We're projected to have massive shortages in physicians, and for the first time in the United States, we're allowing physicians from other countries to practice medicine in over 15 states. We're dramatically short in nurses, in CRNAs, in people that are allied healthcare workers. We are dramatically short. We have a projected 200,000 nursing shortage in the United States, and we turned away 65,000 people because we don't have places for them to train. We work in rural health. Minnesota is a state in the upper Midwest of the United States. We're only 5 million people in our state, and yet we have 45 clinics in rural America where 60% of our patients live in the rural aspects of our area. And in that, we have to staff that with a lot of people, and those people need a lot of training, and particularly around nurses. Our nurses are working at the utmost pace because they're so burdened, because there's so few of them. So if we could be doing discharge summaries, if we could be doing telephone lines, if we could do preoperative scrub assessment, preoperative colonoscopy, we can get more nurses working at the top of their license, because a lot of our nurses are doing things like prenatal counseling that like an AI medical expert could be. And surely our prenatal patients want an expert where they are. So if you live in rural America, the chance that you're near an OB center, you have to drive 100 miles. 50 miles in some case, and we're trying to provide these experts to them in order for them to be able to be augmented, not replace them. We want them to operate at the top of their license, and we want to be able to provide our services to as many people as we can to augment humanity, to enhance the humanity, to provide the best possible care for that patient wherever they are. So we're working across this. We have a home health line business now. COVID forced us to have to treat patients in their house, because we couldn't have enough room in the hospital. So now we have home health aides, and we're doing things like delivering chemotherapy at home to patients across our coverage areas, and those patients have questions. at all hours of the day. And what we want to be able to is to be Mayo Clinic for them, and to be Mayo Clinic for our enterprise, and to be Mayo Clinic for the patients that will allow us to do it. And I'll stop there. And that's really the journey we're going with the AI medical expert. So thank you for letting me come here and give this talk.